I am Dr. Sarah Mitchell, and today we are going to talk about a serious and emotionally challenging condition called Alzheimer's disease. Many people think memory loss is a normal part of aging, but Alzheimer's disease is much more than simple forgetfulness. It is a progressive brain disorder that affects memory, thinking, behavior, and daily life. Understanding the early warning signs is extremely important because early diagnosis can help patients and families plan treatment, care, and support more effectively. In this video, we will discuss what Alzheimer's disease is, early symptoms, causes and risk factors, stages of the disease, diagnosis and treatment, emotional impact on families, prevention and brain health, and common myths about Alzheimer's disease. So let's begin. What is Alzheimer's disease? Alzheimer's disease is a progressive brain disorder that slowly damages memory and thinking abilities. Over time, brain cells become damaged and communication between brain regions becomes affected. As the disease progresses, people may struggle with remembering information, recognizing familiar people, speaking clearly, managing daily tasks. Alzheimer's disease is the most common cause of dementia. Difference between normal aging and Alzheimer's. It is normal to occasionally forget small things with age. However, Alzheimer's disease involves memory problems severe enough to interfere with daily life. Examples include repeatedly asking the same questions, forgetting familiar places, difficulty performing routine activities. UOS, early warning signs of Alzheimer's disease. UOS, memory loss. One of the earliest and most common symptoms, people may forget recent conversations, misplace items frequently, forget important dates or appointments. Difficulty finding words. A person may pause frequently or struggle to complete sentences. Chatters, trouble completing familiar tasks. Simple activities may become confusing, such as managing bills, cooking, following directions. Chachentus, confusion about time or place. People may forget where they are, become confused about dates or seasons. Chatters, changes in mood or personality. Some people develop anxiety, irritability, depression, social withdrawal. Tatu face, poor judgment, decision-making abilities may decline. Factors, what causes? Alzheimer's disease. The exact cause is not fully understood. However, Alzheimer's disease is linked to abnormal protein buildup in the brain that damages brain cells over time. Several factors may contribute, including aging, genetics, lifestyle factors, cardiovascular health problems, monitoring risk factors for Alzheimer's disease. Increasing age, risk increases significantly with aging. Family history genetics may increase susceptibility. Memories, heart and blood vessel problems. Conditions such as high blood pressure, diabetes, high cholesterol may affect brain health. Smoking and poor lifestyle habits. These may increase long-term risk. Stages of Alzheimer's disease. Early-stage symptoms may be mild and easily overlooked. Middle-stage memory problems and confusion become more noticeable. Daily activities become difficult. Advanced stage patients may require full-time assistance with eating, dressing, communication, personal care. Shasheng's emotional impact on families. Alzheimer's disease affects not only patients but entire families. Loved ones may experience stress, emotional exhaustion, grief, financial pressure. Caregiving can become physically and emotionally demanding. How is Alzheimer's disease diagnosed? Doctors may use medical history, memory tests, neurological examination, brain imaging scans, blood tests to rule out other causes. Early evaluation is very important. Treatment options. Currently, there is no complete cure for Alzheimer's disease. However, some treatments may help. Slow symptom progression, improve memory temporarily, support quality of life. Treatment may include medications, cognitive therapy, lifestyle support, brain health and prevention. Although prevention is not guaranteed, healthy habits may help reduce risk. Healthy diet, nutritious foods support brain health. Eat, regular exercise, physical activity improves blood circulation, brain function, overall health. Mental stimulation activities such as reading, learning new skills, social interaction may help keep the brain active. Good sleep. Sleep is important for memory and brain repair. Control chronic diseases, managing blood pressure, diabetes, cholesterol supports brain health. That's safety concerns in Alzheimer's disease. As memory declines, safety becomes important. Patients may forget medications, wander away from home, leave appliances on accidentally. Families often need to make home adjustments for safety. Supporting someone with Alzheimer's disease. Helpful approaches include speaking calmly, being patient, creating routines, offering emotional reassurance, avoid arguing or criticizing memory mistakes. Common myths about Alzheimer's disease. Myth: memory loss is always normal aging. Reality: severe memory decline should be medically evaluated. Rarity: myth: only elderly people get Alzheimer's disease. Reality: some people develop early-onset Alzheimer's disease at younger ages. Rarity: myth: there is nothing doctors can do. Reality: medical care and support can improve quality of life significantly. When should you see a doctor? Consult a doctor if someone experiences frequent memory problems, personality changes, confusion affecting daily life, difficulty speaking or completing tasks. Early diagnosis helps families plan care and treatment. The final message: Alzheimer's disease is a difficult condition, but awareness, compassion, and early support can make a huge difference for patients and families. Protecting brain health through healthy lifestyle habits and regular medical care is extremely important, and most importantly, people living with Alzheimer's disease deserve patience, dignity, and understanding. Closing. If you found this video helpful, stay informed, support brain health awareness, and encourage compassion for those affected by memory disorders. Thank you for watching.